The emergency department, or ER, is a medical treatment facility within a hospital that specialises in emergency and acute care of patients who are suffering from injuries and illnesses that are either life-threatening or require immediate attention.
So, can you explain what your role is?
I'm a certified paramedic, having passed both basic and advanced EMT training in 2 years and getting my paramedics associate's degree. Part of my job is assessing the condition of the patient and ensuring that they are stable on their way to ER. This includes basic airway clearance and evaluation of the patient's cardiac patterns, and to give the best information available to the surgeons. However, my job is not always from accident to ER. Sometimes there needs to be a timely travel from a hospital that is insufficient at treating the patient's current condition to a better equipped facility in that capacity. I'm trained in the administration of medications, infusions, and advanced life support techniques that can sustain the life of adults, children, and even infants.
3, 2, 1, lift!
I am one of the 2 paramedics that were at the scene of the accident that we were called into. I evaluated her for possible brain damage, considering consciousness, and reduce the bleeding experience during travel. I found little sign of brain damage from the incident, and unconsciousness was most likely due to significant blood loss waiting for rescue. The blood loss was caused by what was at first glance just significant lacerations of the legs, but further evaluation indicated internal bleeding to be developing from mild bruising from the accident. When we arrived at the hospital, due to the relative short step of the hospital, my partner and I had to bring the patient directly into ER and commence some of the basic surgery prep for the surgeons.
Due to the unplanned nature of the patients for the ER, the department is required to specialise in treatments for a wide variety of different injuries and illnesses.
Okay, so I'm also a paramedic, and this means that I have the responsibility to resuscitate the patients before they arrive at the hospital, and then also provide them life-saving assistance such as CPR or defibrillation. I'm part of a team of 2 paramedics here who have been hired by the hospital to work directly within it as ER technicians. I believe they wanted us here as part of their staff because we know useful things about what happens inside an ambulance, and we may be able to be more quickly responsive and move the patient around the hospital, if that's needed. And this hospital may also be short on staff, so since they are short, we're paid quite well compared to paramedics who are working elsewhere. For this patient's injuries, I had her being monitored by an EKG or an electrocardiogram to check for her vitals. An intravenous or IV line was also attached into her arm so that she could receive pain medications and antibiotics through her bloodstream. And to help her breathe, a mask was placed over her face. But as for protecting her spinal cord, it was aligned in a way that prevented her stress upon it, so we kind of had to move around the stretcher and all that. And she did need to have some surgery done as soon as possible, so I had to make sure that she was properly placed, prepared and placed in the stretcher and prepared for it as well. We have an emergency, you guys are needed.
We got this.
I am a board-certified trauma surgeon, so my job is to evaluate, diagnose, stabilize, and manage patients who have experienced some type of physical traumatic injury. Emergency room physicians also treat patients who have suffered from traumatic physical injuries. The only difference is that trauma surgeons have specialized in critical care surgery training in medical school. I work around 50 to 60 hours per week, not including the time where I'm on call. Being on call means being readily available to do surgeries or take care of patients when needed. Although there is a huge time commitment to my job, it is very rewarding. So let's talk about what occurred to the patient at the beginning of the video and what my role was in this situation. In this situation, I was in charge of the surgical procedures that the patient needed. I have a general surgical background, so I focus on treating the open, deep cut first to eliminate any risk of blood loss or infection to the wound. I then focus on the internal bleeding, so I found that the patient suffered from many bruises when the accident happened, so she had quite a bit of internal bleeding in her abdominal area. I got a CT scan to make sure the extent of the bleeding to see what the extent of the bleeding was, and this showed me that there was mild swelling and inflammation. Depending on the severity of the bleeding, we can treat it non-surgically. However, I believe that this was a more invasive case where surgery was needed. Although I knew that the bleeding was in the abdomen, I did not know exactly where it was. Thus, I performed an exploratory laparotomy. This is where I make a large incision to suture up blood vessels that I see are leaking. After doing so, the patient is doing well and is in recovery.
Nurse, quick IV.
I'm on it.
We need to take care of the deep cut first and then get a CT scan for signs of internal bleeding. Scalpel.
Yes, ma'am.
Anesthesiology is a medical specialty concerned with total preoperative care of patients before and during and after surgery. As a licensed anesthesiologist, it is my responsibility to ensure that the patient's safety and stability is prior, during, and after a surgical procedure. I provide patients with a type of medication called anesthesia, which helps reduce the pain while they're undergoing surgery. Before an operation, I meet with the patient and go through an evaluation of what is going to happen and make a care plan of how the medications will affect the patient. There are 3 general types of anesthesia given to patients to eliminate pain. General anesthesia is one that is given to lose consciousness and put the patient to sleep until the procedure is complete. It is the most common form of anesthesia given and is generally provided through medications, IVs, and sometimes affiliated through breathing masks or oxygen tubes. Regional anesthesia is given usually during childbirth, being that it is meant to numb a certain part of your body. It is given mostly with an injection on the area that requires numbness. And finally, local anesthesia is given for less exclusive procedures and a very small portion of their body gets numb, and you are generally awake during this process. It is given to temporarily stop the sense of pain for a small portion in your body. For this particular reason, this procedure will be administering general anesthesia. As the surgery progresses, making sure vitals are up to date and the patient is still conscious before and after the surgery. Some background on how I got to this position, counting 4 years of undergrad study, and 4 years of med school, and 4 years of residency, it takes around 12 years to become a licensed anesthesiologist.
We have an emergency. You gotta get back on your job.
I'm on lunch break though.
Oh, hey there. Didn't see you there. I'm Luke, the emergency room nurse, and my specialty is in the ER. I care for the patients within the emergency room, which is why I am the emergency room nurse. People come to the emergency room for various reasons, whether it be due to threatening accidents or minor injuries such as broken bones. I'm here to basically help them and assist the patients and the doctors so that the patients can ultimately feel comfortable and safe to go back home. We prioritize the urgency of care depending on each patient and provide a quick and effective form of treatment to make sure that the patients can feel safe and can return back to their original state. The ER is a very stressful and exhaustive environment, but there's no place that I'd rather be. I also assist the doctors in the surgery and help them to stay on track and basically just hand them the equipment whenever they need it. Yeah.
How can I help you today? I just got from lunch break.
I need to turn in a prescription.
Perfect. I just need to verify some information, okay? So just so you're aware, this is actually a C2. You're getting a prescription oxycodone. So I'm going to have to verify your address as well. So your address, University Pacific,
Yes.
Stockton, okay? And your birthday?
Today.
Today? Oh, happy birthday!
Thank
Congratulations.
you.
Allergies have no be worried of? Okay, perfect. Phone number?
209-876-5432.
Okay, great. All right, wait time will be 15 minutes, is that all right?
Yeah, that's
Okay, perfect.
Thank you.
The duties of a physician can span through multiple jobs of overall patient care, but the word physician is just an umbrella term for a medical doctor and a doctor of osteopathic medicine. In this film, I played the role of an osteopathic physician. My job is to take note of a patient's interconnected system of nerves, muscles, and bones through a complete physical exam, including a check of your posture, spine, joints, muscles, tendons, and ligaments. An osteopathic doctor will also talk with the patient about their medical history, work, home, and family life, all as part of effort to better their treatment.
All right, so prescription for oxycodone. Okay, oxycodone, everything matches perfect. All right, so I need. prescription, Ms. Townsend. Can you please come to the front of the pharmacy? Hi. So your prescription for oxycodone has been fully processed. So this is your prescription, right?
Thank you.
So this prescription, I'm gonna have to, because this is a new prescription you haven't taken before, I'm gonna have to consult you about the medication. So warning is that please follow the guidelines. Take every 46 hours as needed for pain. Don't mix with any other painkillers such as ibuprofen or aspirin. It'll have an overdose. It's very dangerous. Okay, that's for you. And your other medication is aldosterone. It's just for any nausea, anything nausea. As well, take for 46 hours. Don't chew.
Yeah.
Make sure it's all on your tongue. And there you go.
And how long do I take this for? How many days?
So you have a 30-day supply for your oxycodone. Probably, but because oxycodone is a C2 drug, you're not allowed to have any more refills, and you have to revisit the doctor's office. As for aldosterone, you have 5 refills left. Okay. You just call the pharmacy for a refill. Okay.
Thank you.
All right.
Hey yo, I'm the pharmacist here. My name is Ethan Liu. I'm a certified pharmacist. I graduated 5 years ago. Alright, I look pretty young too. During surgical procedures, it's my duty to supervise the administration of any medications during the process. Under circumstances of immediate medication preparation, usually a satellite pharmacy, a little cart, is usually provided to me in order to create or select an influential drug for the patient. As a pharmacist, I have to follow something called the Surgical Care Improvement Project. It's simply a guideline that encompasses multiple procedures. For instance, I have to measure and analyze the sufficient antibiotic levels in the serum and in tissues to adequately destroy bacteria during surgical incision. It is incredibly important because aseptic technique and the preventing of any pathogens entering a patient's body is of utmost importance. Otherwise, it would be detrimental to the patient's health. I also ensure that when the nurses use a syringe, make sure the syringe is actually used properly. Otherwise, you might have pieces of the cork from the medication bottle entering the patient's bloodstream. That is a big no-no, okay? Also, the pharmacist, I have to discontinue any use of biologics within 24 hours of the surgery end time unless stated by the head surgeon. Because you don't want to create the occurrence of antibiotic-resistant bacteria. It's incredibly important as well. As an emergency room pharmacist, I also am deeply weighed in the patient care activities, including medication selection and the prescribing process. I should also suggest revision to medication regimens based on the results of monitoring parameters established from the nurses for the goal of therapy. Also, the pharmacist or the pharmacist must gather medication history in order to understand the patient's profile and to create the correct drug. After the surgery and during the outpatient care is now happens. So, patient usually from her doctor will get a piece of paper that's basically her prescription. Usually, you'll send it over something called drop-off, a procedure called drop-off, where you simply update the patient's profile and insert all the prescriptions, with the dosage, the strength of the drug, what time she wants to pick up the drug, perhaps. After drop-off is completed, it will ship over to QV1, or simply quality assurance, or quality verification 1. So firstly, the first step of making sure that medication that was submitted corresponds to the medication we're going to pull off from the shelves, which leads to production. Production is simply getting medication off the shelves and then moving to a production area where we simply fill the medication or compound the medication into a simple vial or drum that the patient can take home because this is outpatient care. After the production is finished, it goes into QV2, which is quality verification 2, where me, the pharmacist, steps in. I have to verify that the prescription, again, everything's been filled correctly, all the pills manufactured the same, and make sure the NDC is also correct, all right? Using something called a quality scan assurance. After that, it's all finished, scanning everything's checked out, it goes into pickup. Pickup is simply where you just put it into a designated bin for the patient. We know the patient is going to come and pick it up. So we usually call their name, perhaps, and we give medication. And usually I follow up with this is a new medication, I'm going to have to talk to you regarding this medication. Because patients usually, for example, lisinopril or baclofen, these medications, usually an everyday old patient wouldn't know what to do with these medications. It's up to me to explain to them how to take these medications, their dangers, and what kind of foods you can take with these. And any other question the patient has. And at the end of the day, if they have any more questions, they just call me, the great pharmacist, Ethan Liu. Thank you.
The ER operates 24 hours a day, 7 days a week, and has a multiple of different specialist staff working.